My presentation was over the Swedish and U.S. healthcare systems, and I am Emily. The private health insurance and government health insurance agencies in Sweden, healthcare is mostly tax funded and decentralized, so it's like the responsibility of the local councils and local governments, regional councils, that kind of thing. There is public and private health insurance over there as well, but the public insurance is what's like most common. It's very extensive coverage with a small deductible and capped pharmaceuticals, as well as like a lot of the other things are capped that you can have done. And the private healthcare, not very common. It's a lot more expensive. It says here like less than 10% use them, but they always have shorter wait times, like to get stuff done and to be seen. In America, we have both private and government insurance. Private is covered fully by the individuals and often what is like provided by employers and paid for by the individuals that are like a part of it. You might know Humana or Anthem that are those. And then government insurance is paid for, like subsidized by the public. And they're, Medicare, Medicaid, CHIP, those kind of things. Access to health insurance in Sweden, it's universal, guaranteed to have equal and fair access to health care, which is super great. In America, it often depends on what you can afford, like what's available from a job you have, and it's not equal or available to everyone. Cost of service, Sweden, specialists are often $120, like a visit. Pharmaceuticals are like capped off at $246 per year, and a stay in a hospital averages around like $11 a day. America, the average cost of an MRI I found was $2,611. Average cost of an X-ray, $260. Lab work ranged anywhere from $100 to like $3,000, depending on what you were having done. And pharmaceuticals often cost about $1,200 a year. Pretty drastic differences. Does everyone have to have insurance based on each country? Sweden, it's provided for all, so nobody really has to worry about not having it. There's not really a reason why you wouldn't have it. In America, it's required for at least basic healthcare coverage, like for everyone. Like everybody has to have it. So, that's when you get like people with like the bare minimum, like Medicaid coverage. What inpatient surgery specialists are available? Sweden, they have a pretty cool thing. They passed, I think about 10 years ago, it's guaranteed specialist care within 90 days of referral, and then your surgery, like if you need it from like an orthopedic surgeon, is guaranteed within 90 days of like when you see them the first time. So kind of make sure you like are getting seen quick and getting what you need to have done quickly. In America, you're like free to choose what kind of insurance. The doctor is like free to choose what kind of insurance they'll accept, which means who you can see can kind of be limited sometimes. You might not be able to see who you want to see, which can kind of be frustrating if you like know where you want to go and it's not covered, or you're like uncomfortable with who you're supposed to be seeing if it's covered by insurance. Emergency services, Sweden, 112 is the emergency number. There's small to no fee for helicopter or ambulance rides, like if you need a ride to the hospital. The emergency rooms are 24/7, and it's available to anyone in the country, even if you're like traveling over there and you have an emergency. Like they're not going to turn you down. They're still going to pay for everything. It did say like obviously traveler documentation, that kind of thing would be asked for later, but I thought that was super cool. In America, 911 is the emergency number, and I found that hospitals can't turn a patient away in an emergency situation, even if they can't pay or are insured. So like an acute instant, like even if you don't have insurance, you're still going to be taken care of because they're not just going to like let you die. Services available in global ranking. Sweden is ranked number 23 in the world by WHO based on overall efficiency, and America is ranked number 37 in the world by WHO based on overall efficiency. Here are my citations.